Please join me in welcoming Dr. Dave Margolius.
All right. Well, thank you. I am just so honored to be here with you all today. 325 participants is really incredible. I didn't know what I was signing up for when Toby and Lisa came to my office 2-3 months ago to ask me to be a part of this, but I'm so glad I said yes. It's been an incredible experience so far. So, you know what, I can't see my slides. Ooh, up here, that's what I realized. Oh, it's on the right slide? All right. We'll trust. I'll have faith that those slides are working there. So yes, just honored to be with you. Beautiful conference, a beautiful topic. Not my usual venue as the Cleveland Director of Public Health. This is Medina County, and not, this is Brunswick. I'm out of my jurisdiction, and later today, you'll see me on TV 20, which is our local Cleveland city television station, presenting our annual budget to the Cleveland City Council. So please tune in if you want your, if you're looking for a headache. All right, a little bit about me. Oh, thank you. Thank you. I appreciate it. I needed that. So you heard a little bit about me, but I born in Cleveland, grew up here up north in Shaker Heights, moved to San Francisco, did my residency there. And for those up front can see this picture of me about to save a life in an emergency room with my long hair and mustache there in San Francisco. I met my wife in San Francisco, and we got married in 2014, and we knew we needed to leave San Francisco because every month I would get my check from my employer, and I would then give it to my landlord. And so we were looking at all the places all around the country to live. We looked at Phoenix, we looked at Los Angeles, Seattle, Portland, Oregon, Austin, Texas, Denver. But my wife, who is originally from Ethiopia and immigrated to San Francisco after she graduated college, she said she had visited Cleveland during Thanksgiving and things like that, and she said, we should move to Cleveland. Cleveland is the best place. Your family's there, it's affordable, and everybody is so nice. They stop to talk to you. They genuinely want to hear about you and learn about you. And no offense, but you're not all that significant in San Francisco, but maybe you can make a big difference in Cleveland. And so we moved to Cleveland. I applied for one job and one job only, and that was to be a primary care physician at the Metro Health System, which is our safety net system up in Cuyahoga County and Medina. And I worked there as a primary care physician for 7 years. I loved the work. It was incredible. I had a number of leadership roles there, as you heard about. March 11th, 2020, all of our lives changed. It was then that I was in a meeting where our CEO at the time said that we needed to start a 24/7 COVID hotline to take care of anybody who called in the region who was concerned about exposure to COVID, who was concerned about COVID symptoms. And I volunteered. I said, I'm not doing anything because, our clinics had all gone to kind of virtual. And I stepped into that role on March 13th. That was our start date. 2 days later, we launched our 24/7 hotline. On that Friday, we took about 30 phone calls, or I should say it was just me at that point. By Saturday, I had one volunteer on the hotline, one other physician volunteer. We had 70 phone calls. By that Monday, in one day, we did 270 calls and had dozens of physicians who were volunteering. And there just countless people throughout the organization stepped up to make that possible. I did that for 2 years, really enjoyed the work, was still doing all my other jobs, but loved being there. However, in the spring of 2022, we had a new mayor, and a job was posted to be the director of public health for the city of Cleveland. A number of people in my network encouraged me to apply, and I said, okay, I'll do the interviews, and that's it. But pretty soon felt just that it would be the most incredible opportunity to work for the mayor, to work for the city of Cleveland, to improve health for all of our residents in the city of Cleveland. And so there I am getting sworn in with my assistants, the shorter ones, and my boss to my left there. That was August 1st, 2022. So I'm going to start with two stories. One is on the COVID hotline, and then the next will be as a primary care physician. So I was, as I mentioned, running this COVID hotline with dozens of volunteers at the beginning of the pandemic, and then for 2 years. And in the second or third week of the hotline, someone called a woman in her 50s or 60s who was experiencing shortness of breath and sustained high fevers. Folks who are in the healthcare industry will recognize that as symptoms of COVID or maybe severe flu. It was pretty clear that most of the people we spoke to, we really tried to keep at home so they didn't have to be exposed to us at the healthcare system. But it was pretty clear that she was suffering and grasping for breath and needed to get to the emergency room. So I said, I'll meet you down in the emergency room. It's a really scary place to be right now. And at the time, most of the time I was working out of that room in my house, as you saw earlier, but 40 hours a week I was working in the hospital up in my office, about 4 floors above the emergency room. So I said, I'll meet you down in the emergency room, get there as soon as you can. She met me there about an hour later, and emergency rooms at that point looked like this, with lots of masks, very few visitors, lots of plexiglass. It was a pretty scary place to be. But I met her there, and I said, bring your spouse as well. Back then, for way too long, there was a no visitor policy in all of our hospitals. I mean, you were basically dropped off and completely alone. And so what I did was, as she was admitted to the hospital, I snuck her husband into the hospital. Because I knew, I believe in accompaniment, and I knew that it was the right thing to do. Oh, thank you. Well, you're clapping for me now, but wait till the next story, all right? So. And she recovered after about 10 days in the hospital. I mean, severe COVID, especially before vaccines, I mean, it really knocked you out for a long time, where you were dependent on oxygen for so long, and with those long fevers. Story number 2. So as a primary care physician, as I mentioned, I was at the Broadway Health Center in Slavic Village neighborhood and at main campus, and I always sneak in opportunities to show pictures of my long hair before it all fell out. And as a primary care physician, I had about 1,000 patients who I took care of, who were my panel of patients who, if they were out in the community, said, that's my doctor, which was a joy. And that was working about 5 half days as a primary care physician. The other 5 half days is various administrative stuff. A patient of mine who was a new patient to me walked in. He was in his 20s. He came with a parent. And he had been experiencing all sorts of disorganized thoughts, some paranoia, some delusions, rapid mood shifts, and just an overall decline in functioning. Sounded like it could have been, and here's an example of a room that would be in. Sounds like it could have been, severe depression, anxiety, early schizophrenia, bipolar disorder, any number of things. But it was clear to me that he needed to see a mental health professional. At the time, the way to urgently see a mental health professional at Metro was either the emergency room, or you could schedule an appointment, but it would be months away. Or you could go, they had a same-day intake. If you were one of the first to show up at the 8th floor of the main hospital at the C elevators that look like this. And that was the workaround that the department had created at the time, which wasn't ideal, but with the best intents. So if you just show up 9 a.m. tomorrow, if you're one of the first 10, you'll be able to see a mental health professional. And if you can't make it tomorrow, the next day, any weekday. So I gave him those instructions to his parent as well, and essentially wished him the best luck that he'd make it. I did not meet him at the C elevators, the next morning or the next morning. I saw him a few months later in clinic, and he came back to see me, but he had never gone to see his mental health clinician. And that went on for a few years, and he was declining, and over that time had various interactions with the healthcare system and different mental health professionals. But in my time knowing him, he did not get the help that he needed. And we'll come back to this story. I don't have an end to this story. He's, as far as I know, still out there doing okay, but not as well as we know he'd be doing with Accompaniment. So you applauded me, thank you, for that first level of accompaniment. But I did not accompany him in that second moment. And so throughout this talk, I want you to think about those two levels of accompaniment and why they were different. Clearly, mental health stigma is a driving force for so much of the inequality that we see between our approach to something like COVID versus our approach to mental health diagnoses. In this talk, I'm going to talk about Dr. Paul Farmer and Partners in Health and what that organization has been able to build for health diagnoses all over the world. I'm going to speak about Cleveland's health. I'm the Director of Public Health for the City of Cleveland, so I can't do a talk without talking about lead poisoning and smoking and Cleveland's health overall, and so you're going to hear about that. I'm going to talk about Cleveland's mental health specifically and what's been going on over the last 10 years for us. It's been getting worse. And then, because we all need hope, I'm going to talk about some solutions and then come back to this topic of stigma. Dr. Paul Farmer. So when I was an undergrad at Brown, as you heard from Dobie, I first met Paul Farmer. He's this incredible physician. If you want to read about his life, I recommend reading Mountains Beyond Mountains by Tracy Kidder. He went into places all over the world where there was no hope, where there were no foundational healthcare systems, where people were dying from preventable diseases, and where people said to him, treatment won't work, the resources aren't here, people are too poor, people are too sick. And he proved them wrong by building systems. And so he strongly believed in accompaniment. This is someone that Dobie and Lisa and I really bonded over. Today is actually the anniversary of his death. Sadly, he died a few years ago. So for those in the back, the quote on the slide says, "The moral responsibility of the healer is to step inside patients' experiences and accompany them through the worst moments with empathy and expertise, compassion and care for as long as it takes." So he believed that everyone should have access to quality health care, and he acknowledged, but for millions around the world, that wasn't the reality. 50% of people across the globe lack access to essential health care, as many of us know. 94% of maternal deaths occur in lower middle income countries. And every day, 13,800 children die before reaching their 5th birthday. And so that's some of the context behind the founding of Partners in Health. Partners in Health is a healthcare system, a nonprofit that operates in countries all over the world, some of the countries that are the poorest and have the least resources. And I'm just going to give one example of what they do in a country. In the country of Haiti, Partners in Health employs 5,300 local doctors, nurses, and community health workers to serve 4.5 million people. And it's the largest healthcare system in the country of Haiti. And he did that. And the organization of Partners in Health did that when everybody said that it was impossible. There were just not enough resources. And so that's just one example from one country, and he's doing that in dozens of countries all over the world. How does accompaniment fit into the Partners in Health model? Well, they said on the website, at Partners in Health, accompaniment has no time limit. Only by keeping an open commitment to collaboration can we aspire to solve problems caused by centuries of oppression due to colonialism, the slave trade, and systemic racism, and find the hope needed to overcome seemingly insurmountable hurdles. So in the case of Partners in Health, those insurmountable hurdles, colonialism, slave trade, systemic racism, have led to HIV, tuberculosis, Ebola, and mental health diagnoses, crushing diagnoses in these countries that have been most affected by those systems of oppression. And even with all that despair and those challenges, Dr. Farmer and that organization has worked together to overcome that. So as Dobie mentioned, I was pretty inspired by that, as a college undergrad, and thought, well, maybe I could go work at Partners in Health and be a part of that organization. Certainly did not want to move back to Cleveland. But fortunately, I met people like my wife who inspired me, and just know about all the troublesome health disparities and outcomes that we have here in our own backyard that need the help. So we don't need to travel across the globe to make an impact and really address these problems here. And so that transition happened for me kind of later in med school through residency, and I'm really happy to be here. When we think about insurmountable challenges in Cleveland, in the city of Cleveland, it begins and starts with our life expectancy. So our life expectancy in the city of Cleveland is in the mid-60s in many of our neighborhoods, compared to the high 80s in our inner ring suburbs. So just a mile away, huge difference in life expectancy. And the graph over to the right shows life expectancy across the country by race. Life expectancy for Black residents in the country is about 10 to 15 years shorter than life expectancy for our white residents, and that gap has not closed over time. And what I hope to convey to you here is that's not due to different genetic differences. Those different genetic differences have long gone away. It's due to different societal pressures and different systems of oppression that cause premature death, and particularly our Black residents in Cleveland. And I'm going to talk through two of the biggest systems of oppression, two of those biggest pressures that cause that life expectancy gap. So number one, there is a large and persistent wealth gap between our Black neighbors and our white neighbors in the country and in Cleveland. For every $1 of wealth that a white family has, a Black family has accumulated at 12 cents. And that starts with slavery, when there was obviously no wealth accumulation for Black families, but continued through modern day. Some examples are the GI Bill benefits that were guaranteed to veterans of World War II, said you could go to college for free if you served in World War II. Unfortunately, it wasn't until the late 1950s, 1960s that half of the universities in the country admitted their first Black students. And so Black families, Black vets came back from the war and weren't able to do the same wealth accumulation, same education that was free as white veterans. Redlining was a practice by banks that unfortunately still has some persistence today, where a white family living in a neighborhood was able to get a favorable bank loan, whereas a black family was either denied the loan or given a loan with a very high interest rate. And so homes in black communities, predominantly black neighborhoods in Cleveland, were not able to be invested in the same way that white neighborhoods and white families were able to do. And that had major implications on health. So this is the redlining map that I described. And not only did that lead to differences in the quality of homes in neighborhoods in the city of Cleveland, but it also has led to a persistent segregation. And that's the second force from structural racism that we see today. So our poverty rate in Cleveland as a result of these forces is extraordinarily high, one of the highest in the country at 46% of our families with children are below the poverty line. And 23% of our families with children are below the severe poverty line, meaning that the family income is less than $15,000 in 1 year. Did the number of people in poverty increase to cause this huge percentage, this high percentage of poverty in the city of Cleveland? Not so much. Much more was we had a population of nearly 1 million people in the 1950s in the city of Cleveland. And now our population is down to about 375,000. And so it wasn't that our poverty, the number of people in poverty increased, it was that all of many of the people with wealth moved. And they moved to not only the suburbs, but they moved to California, Arizona, Southeast, to get out of Cleveland. And so what that left was a lot of concentrated poverty, which causes health problems in a few different ways. And I'm going to show you a couple examples. So lead poisoning in the city of Cleveland. Cleveland's lead poisoning is because many of our homes in those red light neighborhoods have deteriorated over time. And so those in the front can see a home built about 100 years ago that's in pretty rough shape. And on it, it says in spray paint, "Mayor Bibb, please, please, please tear this house down." And that was on Kinsman Road along the parade route for our annual Labor Day parade. And it was torn down just a month or two after the Labor Day parade. But we have about 150,000 houses that are in various states of disrepair that were built long before lead paint was made illegal. And so our lead poisoning rate is extraordinarily high, where in 2005, 52% of our children in the city of Cleveland tested positive for lead poisoning. 52%. Lead causes irreversible neurotoxicity, brain damage. That number has dropped over time, but unfortunately, the last 5 or 6 years has been stable at about 1 in 5 of our children in the city of Cleveland testing positive in their blood for lead from paint chips and paint dust from these old homes. On this map, every single red dot, there are 1,500 of them, represents a child who tested positive for lead poisoning. So lead poisoning is one example of how these forces of oppression have caused health problems in our city. Smoking is another problem. So in Cleveland, our smoking rate is 35%. 35% of adults have smoked a cigarette in the last 30 days, which is 3 times higher than the national average, which is about 11% right now. We also have the highest rate of deaths from lung cancer of all of our comparison cities. Folks will see this statistic and say, well, that's because it's very stressful to live in Cleveland. And it is, because of all the issues that I've been discussing and we'll continue to discuss. But it's really not because of that. It's by design, where tobacco companies knew they had to find new customers as our general population declined in our smoking rate. And in their books and their marketing plans, they said, we're going to find new smokers. They're going to be poorly educated. They're going to be kids. They're going to be poor. Poverty markets in general became a target of the industry, and they're going to be black. And in the literature, in their documents, their marketing plans, someone wrote this down. They said, we're going to go to Cleveland, St. Louis, Baltimore, to black neighborhoods, and we're going to give out free menthol cigarettes to addict new customers. And so you can see this map of Cleveland. Each of these dots is a tobacco retailer. There are about 600 tobacco retailers in the city of Cleveland. That's one for every 600 residents. So it's not a personal failing of people in Cleveland that our smoking rate is so high. It's the environment, and it's decisions made at a higher level. So in addition to lead poisoning and smoking, something else has been going on in Cleveland, and it's not just Cleveland. It's isolation. And so this ties back to why we're all here for accompaniment and thinking about accompaniment. But something happened in 2020 that I described earlier where we really accelerated the isolation that was happening in our community. We said no visitors. We canceled a lot of schools and went virtual. And we did all those things for way too long, honestly. I mean, we had the vaccine. We knew a lot more. We knew we didn't have to wipe down cereal boxes with bleaches. We knew plexiglass didn't prevent the spread of viral respiratory illnesses. And honestly, for a long time, I have blamed a lot of those kind of over-restrictive policies for our rise in isolation. And I thought, that this rise in isolation and loneliness is really started in 2020, or was just greatly accelerated in 2020. But there was something else going on before 2020 that has increased isolation. And Bishop Dolan has already referenced it in his earlier talk. I had 25,000. If 25,000 touches of the iPhone is the average, I think someone in here is zero because I'm at like 50,000, unfortunately. And I have two of them I have to carry around for my. Exactly. And so, unfortunately, a lot of the isolation data points didn't begin in 2020. They really began in 2012. So this graph here shows daily average time with friends in minutes, looking at different age groups. And that blue line at the top there is ages 15 to 24. And that line is going around steady until about that black line is, the vertical line is 2012, and then it drops off. Daily time with friends drops off and decreases in 2012. Young people who struggle to find meaning in life began to rise in 2015. So this is a graph showing, in response to survey question, are you struggling to find the meaning of life amongst young people, I think the same age group. And you can see that steady, steady, steady until 2012, 2015, where it begins to rise. And then mental health diagnoses follows shortly after. The percent of US undergraduates diagnosed with a mental illness, steady until about 2012, and then it begins to rise. And the blue line is anxiety diagnosis, the yellow line is a depression diagnosis. And so it's really important to note, as Bishop Dolan said, mental health diagnosis is everything to do with brain chemistry. It is not a personal failing. It is a diagnosis of health. However, there are situational factors in society that have increased the number of diagnoses that we're experiencing. And it can't be explained away by just the fact that maybe there are more mental health clinicians and more diagnoses happening. And you guys know there are not more mental health clinicians, so that's not what's going on. There really is something happening at the societal level, which is changing our brain chemistry and leading to this higher rise in diagnosis. So what does Cleveland look like over that same amount of time? Two graphs showing similar data, a rise in mental health diagnoses and a rise in suicides in the city of Cleveland that really began about 10 years ago, 10, 15 years ago. As a result, Cleveland has one of the higher suicide rates in the country at 15.5 per 100,000 residents. So I promise some hope, don't worry, we're getting there. So Paul Farmer's organization, Partners in Health, wrote, these are things that neither you nor your patients can fix, and yet you have to manage them somehow in order to help your patients swallow their pills every day, get to their appointments on time, and renew their Medicaid applications. Accompaniment is incredibly difficult because you must walk with patients as they suffer from the violence of poverty, racism, illiteracy, social isolation, and fatalism. And yet, we must try, right? That's why we're all here. That's why I'm so excited to be in the job that I'm in. That's why I'm so honored to present to City Council this afternoon my annual city budget. People ask, why are you smiling? That's just a joy to be here. Paul Farmer said, with rare exceptions, all of your most important achievements on this planet will come from working with others, or in a word, partnership. We can't do it alone. We know at this point in time, especially with some things happening in the federal government, that we must look to each other to help overcome some of these insurmountable changes. So I'm going to pivot to some challenges and solutions that we've experienced here up in Cleveland. So number one, I'm going to talk about our Home for Every Neighbor program. In the city of Cleveland, last year, there were about 150 people who were experiencing unsheltered homelessness, which is a pretty low count relative to a lot of other cities. I think Phoenix, unfortunately, is around 10,000 or so folks sleeping outside every night. But in Cleveland, it was, we think just around 150 people based on our count. And they were sleeping in campsites, in tents and sleeping bags on the street and places that look like this. When I was first approached about this challenge, I honestly, by the mayor who said, we got to do something, I said, I don't. So it's such a hard problem. How can we fix it? And fortunately, with partnership, we've built a program called Home for Every Neighbor, where we set a goal to engage folks who are living in campsites and get them into housing within 1 week. We had a goal of 150 people 18 months after we started. We started last spring. And we are, as of yesterday, at about 140 people who last night spent the night in a home. Thank you. And how do we do that? So obviously a strong partnership with our county, with a number of nonprofit organizations, but above all, it was looking past the hesitations, the concerns that it couldn't be done. Many people, including people in the space, told us that the people who sleep outside every night, they do not want to be helped. They told us if they wanted to sleep inside, they could go to the shelters. They said the people who sleep outside have the most severe mental health illness, and it's too hard. Focus on the people who want to be helped. And so we look past that. We didn't believe them. We had anecdotal evidence from during COVID when we had money to put people up in hotels that actually people were okay with that, and that there are some people who didn't want to be in the shelters. A few reasons. One, they had a dog. If they went into a shelter, they would lose their dog. Others, they were married, they were partnered up, and they wanted to stay with their family. Other folks had terrible trauma in the shelter for one reason or another. And so through accompaniment, through talking to people, learning what they wanted, we found apartments for people, and have paid for those apartments for 1 year, and they're in case management, and we're working with them to make sure that that 1 year is not just a blip, that they can sustain. And today, when I present that budget, there will be another $2 million in my budget to continue the program. Another challenge followed by a success story, hopefully. In Cuyahoga County, our infant mortality rate decreased by about half in 2020, 2021, 2022 from 2019 numbers. Historic lows, never been seen before in our county. Babies making it to their first birthday. Unfortunately, in 2023, that number of deaths of infants in our county jumped back up to the 2019 levels. Why? Well, something else jumped up back to 2019 levels in 2023, and that was the rate of childhood poverty in the country and in Cleveland. Childhood poverty rate in 2020, 2021, 2022 across the country dropped from 11% to 5 or 6% across the country. For 3 years, we halved our childhood poverty rate. How did we do that? The child tax credit. In those years, passed legislation as a result of part of the COVID recovery, any family with a child under the age of 5, instead of getting $1,000, $2,000, got $3,600. Any child between the age of 6 and 17, the family got $3,000. This was a bipartisan legislation passed through the House to continue this forever. But when it came time to vote in 2023 to whether or not to continue, the senators, overwhelmingly the majority of senators didn't vote for it, so they didn't have a majority. And the reason they gave for not voting for it is they said they didn't want to give the incumbent president a win before the election. And so they voted no, even though both parties campaigned on it. And so that tax credit ended, the child poverty rate jumped back up to where it was in 2019, and subsequently our infant mortality rate jumped back up to where it was in 2019. So, sounds a little, that this is a sad story, but it's also, we know we can do this. We know we can do this. We've done it before, we can do it again. All right, next, challenge followed by solution. So, when I was at Metro, we surveyed our employees, our 8,000 employees, how did you get to work today? 96% responded that they got to work not only in a car, but in a car alone. 96%. And I imagine that might be something similar to how we all got to the conference today, based on all the parking lots, right? That's isolation. And communities across the world have come up with different models of transportation such that you don't have to drive isolated in a car to get to work. This is a relatively new and unfortunately American phenomenon. One of the things that we're trying to do in Cleveland is a model called the 15-minute city. And what that means is we're really trying to incentivize new housing and development around high frequency, highly reliable transit corridors so that you can live in a place where everything you need is within a 15-minute walk. Instead of having to get in the car for work, having to get in the car for groceries, having to get in the car for church, for community, you can walk to those things. That matters. Isolationism, and especially the newer phenomenon of people in cars driving alone and also on their iPhone at the same time, is incredibly dangerous and leading to those outcomes that we described. So specifically, challenge number 4, followed by solution. Let's go back to my patient who needed help in that moment, who needed to see a mental health clinician. That was in 2016, 2017. Fortunately, today, there are a lot more solutions that are available, more widespread. So there are 4 of them on this slide, and I'll talk through them quickly. Number 1, integrated behavioral health. So in our primary care clinics today, many of them, we have a behavioral health clinician who works side by side with the primary care physicians. So no more making appointments months in advance. If this gentleman had come into my clinic in 2022, when I last worked there, I would have introduced him to the licensed clinical social worker who works in the clinic with me. And she would have done that intake appointment without the instructions to go to elevator C. Behavioral health urgent care. So we are lucky in Cleveland to have a number of behavioral health urgent cares, help and funding from the Adams Board and run by the centers, where folks experiencing mental health crises, whether it's an emergency or an urgency, can go into one of our behavioral health urgent cares and see someone same day who they know. Care response. So this is a program also funded by our local Adams Board, where if you call the crisis hotline 988 for help, instead of just getting a person on the phone who you can talk to, you have the opportunity to have someone actually come out to you, to accompany you, to be with you, to meet your needs. And then lastly, in the rare cases where someone is having a mental health crisis that somehow impacts public safety, we have 8 teams now of police officers who have social workers as their partners, licensed clinical social workers as their partners, and that's called the co-response model. And we're really proud of that in Cleveland as a best practice. And so these are just a few of the highlights, and specifically in the mental health treatment space, that really build on accompaniment and being present with someone when they're experiencing mental health diagnoses and crises. So remember how the story began with my COVID patient who I met in the emergency room in an environment that looked like this. The young gentleman who's my patient in clinic who I did not accompany in elevator C on the 8th floor at Metro at the time. And I asked, why was my level of accompaniment different? And I think that's why we're all here today, to overcome this difference, to bring our approach to mental health diagnoses, our mental health challenges, to equal or better to our approach to physical health diagnoses. Clearly, stigma is at play here. There are a number of ways together that we can get over stigma. It's using the right language. It's educating ourselves and others. It's equality between physical and mental illnesses. It's really everything that Bishop Dolan mentioned earlier about education, accompaniment, and advocacy. I really like that framework. And so with that, I have reached the conclusion of my presentation, and so grateful to be with you all, and we'll take some questions from Dobie. Thank you. Okay. Oh, great.
I'll sit here. Thank you, Father Dave, and Father Dave.
Been promoted, huh?
And Dr. Dolan. Thank you, Dr. Dave. Actually, one of the things that is a tie that binds each of your presentations is the intentional strategic connection with science and medicine and government institutions to address some really very hard problems that we're trying to address. I think, and thank you too for the data part. I know that's not a pleasant or easy picture to share, but I think the first question I'd like to ask you on behalf of our community gathered is, a lot of people in seeing some of these struggles in Cleveland said, well, one solution is just leave Cleveland. And now that I'm not in Cleveland, those aren't my problems. And how do you, with that mindset of accompaniment, why should we all care about these things as if it were in our communities when we're part of Northeast Ohio? Like, how do you make that connection that, it's not my issue, it's those people?
Yeah, thank you. That is the question. That is the most important question in my work. How do you stop thinking about the health problems of Cleveland as those people? And I think it is accompaniment that is a part of that solution. It is spending time with people who are experiencing these systems of oppression that we see in the city of Cleveland in a judgment-free zone. I think it's easy to amplify the bad noise that's out there about cities, across the country. Look what's happening to those cities, right? But they're happening as part of a bigger system. They're happening because resources have been taken away from those cities. And people are suffering because those resources that were once there aren't there anymore. And so I would say, if you do not live in the city of Cleveland, spend time getting to know people who do. Spend time with organizations that help people in the city of Cleveland, and just spend time with people who have different experiences other than ourselves.
Wow, thank you. So what you mentioned everything from the income tax credit and the effect that had directly. How do the work of your office and all of us here thinking accompaniment, what can we do to better walk with those who suffer? Because one of the risks, folks, we all have with accompaniment is we could easily see it as an intramural sport. Our organization, our church, hey, we should accompany each other more. But what you have illustrated so powerfully is accompaniment means going into their place of suffering. And their obstacles at some level become our obstacles too. How do you build that bridge and then move, not just to be with, definitely yes, but to be with to make better?
Yeah. With intention. So you have to intend to do it. I think one example of a place where Catholic Charities has helped is with our refugee population, our newcomer population in the city of Cleveland. So we have thousands of people who enter the city of Cleveland every year as refugee status. And Catholic Charities is one of the organizations that helps with resettlement. One of the things that we've learned through our public health data is that, unfortunately, our lead poisoning rate in the city of Cleveland, as I mentioned, 18% of our children, all children, aged under 5, 18%, 1 in 5, testing positive for lead in their blood. Our positivity rate for our refugee population is 52%. And when I first saw that data, I'm going to be honest with you, I thought, oh wow, okay, maybe Cleveland's not the worst. Maybe there's something happening in Afghanistan or the Central Africa or Ukraine, where refugee populations come from, that they're getting lead poison there. But that's not what's happening. What we know from our inspections and from the timing of the lead poisoning tests is folks are fleeing wars, crossing oceans, ending up in Cleveland and being lead poisoned here in the city of Cleveland. And the reason for that is because we have like 3 days notice when someone's coming to live here in our city, and there aren't a lot of housing options. And so many folks are ending up in really deteriorated homes, those same homes that I have described to you, and then getting lead poison. And so that is fixable. That is fixable. The homelessness, we talked about that. It's the same principle. It's just we need to have better homes for folks to get into. And so that is something that we are working on with Catholic Charities to fix this very solvable problem, even if it means every time we find a home that's better, we save that for a family with young children or expecting a children. Because lead poisoning doesn't affect adults, because adults aren't crawling around, putting our hand in the mouth the way that babies are. And so that is solvable, and that's something that anybody here, we can all participate in.
Wow, thank you again. One of the reflections from Paul Farmer, I know in my reading his work, he has a line that says, the root of all these problems is when some lives matter less than other people's lives. Right. And as you bring this message, same question we had asked Bishop Dolan earlier, what is it that gives you hope? Because one of the things I'm aware of is something I read years ago, human growth begins where blame ends. It is so easy to blame those people. And yet, these are solvable problems that have been solved for so many people for decades, and yet we have some people where the problem is not being solved, certainly not in the way that it could be. So you're in a hard position, not just because of your budget meeting, but what gives you that this is the fight I want to be in, the hope that drives you to keep this moving forward?
Yeah, I'll be honest, I was not looking forward to this question because it's been a rough couple weeks. Half of my staff at the health department are funded through federal grants. And that's 60, 70 people who, I've been worried that I might have to let go. And not only am I worried about, them and their livelihoods and their families, but the work they were doing is pretty important. They're monitoring our air quality. They are preparing us for public health emergencies. They are community health workers visiting new mothers to make sure that baby gets their first birthday. And so it's been a rough week, but people need us. People need us to be present in this moment, to serve our community. All of us are in that position. And so the hope is that I always pull from is all of you, the people that I meet, the people that I work with, from hearing the bishop's talk earlier, from hearing you speak, that's what gives me hope. And we're going to need it because this is a rough situation that's going on right now.
Thank you, and thank you for your honesty about that. I think I'm going to ask all of us a question, and slightly unusual, but I'm going to ask you to just answer this out loud. So you're hearing it live. Whatever comes to mind, please answer it out loud. Who in this world Who in this world is outside of God's love and mercy? And the answer is?
No one.
He had to get it on the record, you know? Dr. Dave, I want to just thank you. I think the day-to-day courage that it requires to be a voice for the voiceless. You have reminded us that accompaniment is not just the beautiful pastoral part that we heard so well from you, Bishop. It's also the I will come and enter into your pain with you. Your obstacles are not just your obstacles, they're our obstacles, and we can address them together. And I find that an incredibly hopeful vision that you shared with us, while you also reminded us that facts matter, the problems can be solved, but every one of us here has to say, I'm going to do my part to make some of these things better. Amen? So, let's thank together Dr. Dave Margolius.